As businesses and organizations either close their doors or scale back events, fewer blood drives are taking place. Every 2 seconds, someone in the U.S. needs a blood product. And as the nation's supply faces a severe shortage, the American Red Cross is calling on all eligible donors. We learn more about the situation from Southern Arizona Executive Director Courtney Sloniker and Regional Executive for Blood Dan Cavanaugh. We should note Cavanaugh also serves on AZPM's Community Advisory Board.
Right now, as of March 18th, across the country, we've had 4,000 blood drives cancel for different reasons, resulting in about 100,000 fewer blood units collected. To put that in perspective locally, here in Southern Arizona, we've had over 52 blood drives cancel, resulting in about 1,300 fewer blood units collected, and we're expecting that number to only increase.
Dan, how does this translate to, who does this impact? The average person who relies on these regular transfusions, for example?
We provide 40% of all blood in the nation, and we're the #1 generator of blood in this area. So really anyone who ends up with a need, quite often that isn't anything planned. Something unfortunate happens, you end up in the hospital, somebody needs blood, and you always assume it's there. And it's because, in part, the Red Cross has been so successful. And that's why when there's a shortage here, it becomes important throughout the region.
Where's the balance in all this? Because we're not supposed to be going out, we're supposed to be far apart from each other, and now you want blood. So how do we make all this work?
So we know that we absolutely have to continue our blood collections to ensure we save people's lives. The U.S. Surgeon General has stated we can go out to give blood. There are certain functions here that to support our community that are absolutely required. Your hospitals, your grocery stores, your pharmacies, and your blood drives. Without the blood drives, we cannot deliver on our life-saving mission and save lives with the blood products. So it's one of the big asks that we're asking the public to come out as one of those basic necessities for our community's health.
But you are seeing organizations cancel blood drives because the people aren't working anymore. So how do we do this?
So that is a great question. We have a lot of organizations that step up and host blood drives all throughout the year. We are so grateful that they do that. But yeah, they're going to, their teams are working remotely. People aren't coming into the office, but we're asking, please still host your blood drive. We are seeing donors still coming out to donate, but we need the space to host the blood drives.
Now, Dan, big picture wise, this has happened before where we've had these shortages. So how have you addressed the need in the past? What can you take from those experiences and apply them now?
Most folks would rather, as the old saying goes, light a candle than curse the darkness. Somebody was saying, I don't see anything good. I think a lot of people say, here's my chance to make a difference. I can go out and be a hero. I can help save somebody's life. I can help someone who's facing a cancer challenge. I can go home and feel good about myself tonight when I see the issues facing America and the role that I'm playing.
This is tricky though, because it is flu season, a lot of us not feeling like we're capable of doing this. So what sorts of things should we ask ourselves before finding a donation site?
So we're asking all healthy individuals to come out and donate. If you have questions about the donation process, please call us. It's 1-800-RED-CROSS. If you're unsure about donating, if you have questions in relation to coronavirus, give us a call. We'd love to talk to you about it, but we're asking all healthy individuals. We want to protect you as a donor, and we want to protect the client that's going to need that product.
If you've been inside one of your mobile units, it's kind of tight in space in there, and if you've been down to one of your facilities, I mean, you're pretty close to people. So how's this all going to work?
So the Red Cross has implemented additional safety protocols in an abundance of caution in addition to the safety protocols we already have in place for collecting blood. We want the public to know it is a safe process. The protocols we've implemented in response to the coronavirus, we do pre-screening temperature checks of anyone that comes to a blood drive. That includes our staff members, our volunteers, and the donors that are coming in to donate. Everyone gets a temperature check. We've enhanced our disinfecting procedures, and where possible, we have practiced the social distancing measures, spacing the donation beds further apart. Our staff are practicing social distancing measures as well, but we do have those safety protocols in place already and have already enhanced them.
You can go to redcrossblood.org. You can type in your area code and they'll give you the nearest place and time where they've got a nearby blood drive, or as Courtney said, you can call in and make an appointment.
All right, Dan and Courtney, my thanks to both of you.
Thank you so much.